Hernias are a common medical condition. However, have you ever heard of Spigelian hernias? They are a unique and rare type of hernia and aren't as recognized as their counterparts such as inguinal or hiatal hernias. Despite being lesser known, Spigelian hernias are incredibly captivating due to their rarity especially in children. In the intriguing world of medical anomalies, Spigelian hernias undeniably hold a place. They occur due to a weakness in the Spigelian fascia, a crucial part anatomy. This fascia forms an essential element of our abdominal wall. It's a thin but vital layer holding our organs in place. A weakness here could cause tissue to protrude, leading to a Spigelian hernia. Now you must be wondering, what does a Spigelian hernia look like? What could be its symptoms? Typically these hernias might be identified as a small bulge that becomes visible on the body's exterior. This bulge is often accompanied by pain, though this isn't always the case. In fact, in some circumstances, there may be no discomfort at all, making it quite a challenge to identify or diagnose this condition. Dr. Smith, a leading pediatric surgeon, shares an experience. "I once treated a 7-year-old boy with a small yet noticeable bulge on his abdominal area. He didn't complain of pain but had a persistent cough. An ultrasound revealed a Spigelian hernia. It was surprising, as only 2% of all hernias are Spigelian. In rare and severe cases, Spigelian hernias can lead to a medical complication called strangulation. Strangulation, in the context of hernias, refers to the cutting off of blood supply to the herniated organ, posing a tremendous life-threatening risk. This requires immediate medical attention. Diagnosing Spigelian hernias is complex due to their infrequent occurrence and elusive symptoms. This usually involves a physical examination by a medical professional, complemented by imaging techniques such as ultrasounds. Medical imaging specialist Dr. Jones explains, ultrasounds are extremely efficient in identifying Spigelian hernias. The high-frequency sound waves create a real-time visual of the patient's inside, revealing any herniated tissue. Treatment generally involves surgical intervention, aiming to push back the tissue and repair the weak Spigelian fascia. Post-operative care and regular follow-ups are crucial, emphasizes Nurse Taylor. They ensure complete recovery and prevent recurrence. While the odds of encountering a Spigelian hernia aren't particularly high, it's essential to be aware of this condition and its potential effects. Early diagnosis and prompt treatment can vastly improve the prognosis and contribute to a smoother recovery process. Therefore, if you ever notice anything unusual or experience persistent abdominal discomfort in your child, don't hesitate to consult a pediatric surgeon or a healthcare professional. This simple step could prevent any outcomes and ensure your child's well-being. As the famous saying goes, prevention is better than cure. Regular abdominal exercises can strengthen the abdominal wall, reducing the risk of Spigelian hernias. Additionally, maintaining a healthy weight and avoiding heavy lifting can also contribute to prevention. Like and share to spread awareness. #Spigelian hernia, #pediatric surgery, #rare disease. As we wrap up this discussion on Spigelian hernias, let's revisit the key points. Spigelian hernias are rare, making up only 2% of all hernias. They occur due to weakness in the Spigelian fascia, a vital layer of our abdominal wall that holds our organs in place. This condition presents itself as a small bulge in the abdominal area, often accompanied by pain, though not always. In some instances, the only symptom might be a persistent cough, as we learned from Dr. Smith's experience with a 7-year-old patient. The rarity and elusive symptoms of Spigelian hernias make them challenging to diagnose. This is where physical examination and imaging techniques, like ultrasounds, play a pivotal role, as emphasized by Dr. Jones. Treatment typically involves surgical intervention, followed by post-operative care and regular follow-ups, as established by Nurse Taylor, to ensure a full recovery and prevent recurrence. Perhaps most importantly, we learned that early detection and treatment are critical. If you notice anything unusual, such as a persistent cough or a tiny bulge in your child's abdominal area, don't hesitate to consult a healthcare professional. This simple step can make a significant difference in the prognosis and recovery process. Lastly, remember that prevention is better than cure. Regular abdominal exercises, maintaining a healthy weight, and avoiding heavy lifting can minimize the risk of developing a Spigelian hernia. As we conclude, let's remember the importance of raising awareness about this rare condition. Share this video with your friends, family, and social networks. Use the hashtags #Spigelian hernia, #pediatric surgery, and #rare disease to help spread the word. Thank you for joining us in this discussion. Stay informed, stay healthy, and keep sharing the knowledge.